Hello everyone. So in this video, I'm going to give you a general overview of the PLAB 2 exam. What are the type of stations, the number of stations, the time required, and I'm going to discuss with you the marking scheme in detail. And also I'm going to give you a few tips and tricks on how you can start your preparation. Okay. So first of all, PLAB 2, it is an OSCE type of exam. If you have taken OSCE in your medical school, then you know that there are stations and OSCEs, and then there are examiners and simulators, and there is a certain task that you need to perform. Okay, so PLEB 2 is just like that. So first of all, the number of stations. There are going to be 18 stations in your exam, and usually the two of them are rest stations and 16 are actual station. Okay, so in these two rest stations, like you can go and attend the toilet, you can, eat something. There are some biscuits and some stuff to eat. Also, there's water and tea, coffee, etc. on these two rest station, and 16 stations are actual stations. Okay. So the time for each station is 8 minutes, but 90 seconds you spend outside the cubicle reading your task. So outside a cubicle, which is a small room, on the wall, a task is written, okay, and you need to read your task in these 90 seconds, and then you enter your cubicle. When the bell it rings and it tells you to enter the cubicle. When you enter the cubicle, you are going to greet your examiner, and then you are going to start your station by talking to your simulator, okay? Then there are different types of station in PLAB 2 exam. And I'm going to discuss each and every station in detail with you here. So a very common type of stations are basically history-based stations. In history-based stations, a patient present to you with certain symptom. Okay, so he might say, doctor, I have fever, or doctor, I have cough, or I have chest pain, or diarrhea, or whatever. Okay, so they will give you a presenting complaint, and then you need to take a history, detailed history of that presenting complaint. Okay, and then when you come to the examination part, you don't really do your examination here. Okay, but you just verbalize your examination, and then you proceed to the management part and you explain your management to the patient. So these are called history-based stations, and these stations can be from medicine. The presenting complaint from can be from medicine, from peds, from gynae, eye, ENT, surgery. Okay. So in these stations, you just need to take a thorough and detailed history of the presenting complaint and then the rest of the history. And then you're going to ask ideas, concerns, and expectations from the patient. And when you come to the examination part, you don't examine the patient. So what do you do? Instead of examining the patient, you are just going to verbalize your, whatever you want to examine. So for example, this patient has presented with cough. Okay, and you've taken the detailed history of cough, and then you ask about the past history and medication history and any other medical condition, allergies, family history, the psychosocial, the lifestyle history. And then you want to, in examination, you want to do, vital, you want to record vital signs, and you want to auscultate the patient's chest so that you can listen for wheeze. So you are not actually going to get up from your seat, and you are not going to carry out all these examination on your simulator. Instead, you are going to say that, thank you so much for answering all my questions. Now I would like to examine you. I'll be checking your observation, which includes your heart rate, your respiratory rate, your oxygen saturation, okay, and your temperature. And I'm also going to have a look at your chest and listen for your heart sound and lung sounds, okay? So when you verbalize this, the examiner is going to give you a sheet of paper, okay? And on that, there will be written examination findings, okay? So for example, if this patient has wheeze on auscultation, so on the piece of paper, it will be written that this patient has this much respiratory rate, this much oxygen saturation, this much temperature, and his, on just auscultation, there was wheeze, and the rest of the examination is normal, okay? So then you are going to say, you are going to pretend as if you have examined the patient, and you are just going to tell the simulator, thank you so much for bearing with me. I've examined you, and your examination showed this, okay? And then you will proceed to your management part. So these are basically your history-based station. Then we have something that we call as combined station. So in combined station, you have to take the history, but you have to actually carry out examination as well. Okay, now examination you might need to carry out on your simulator, okay, or you might need to carry it out on a mannequin. Okay, mannequin is just a dummy. Like for example, if you need to, if in this station it is required for you to do abdominal examination. For example, if the patient is complaining of ascites and you are required to do abdominal examination, then there will be a dummy of the abdomen, and you need to perform your examination on that dummy. Okay, but there are certain examinations that you might need to perform on the simulator as well. Okay. So in combined station, you need to take a history, but here the history will be, you will try to take a shorter history as compared to the history-based station. So we'll take a shorter history because you need to give some time to the examination as well. Because you are going to carry out the examination here, and you are going to pick the findings on, yourself. The examiner is not going to tell you the finding here. So for example, on abdominal examination, there is there is fluid thrill and shifting dullness. So you need to pick it on your own. If there is going to be a palpable mass, you need to pick it on your own. The examiner is not going to tell you. So you need to give some time to the examination in this station. So the history is going to be short. And then of course, after examination, you are going to the management part and explain your management to the patient and give appropriate treatment. Okay. Then some stations are procedure based. So in these stations, you are required to carry out certain procedure. For example, it can be IV cannulation or it can be, nasogastric intubation. The normal procedures that we normally do in wards like arterial blood cases, venipuncture, etc. So these procedures, again, you are not performing them on, you're not performing them on actual people, you are performing them on mannequins. So for example, for IV cannulation, there will be a mannequin of the hand, and when you enter the cannula, the blood comes. Um, so then we have communication skills station. So in communication skills, they're going to assess your soft skill, your interpersonal skills. So in communication skills, you don't really need to diagnose the patient, because in history based station and in combined station, the patient present to you with certain symptoms, and you need to then, take the history and do the examination and, come up with a diagnosis and explain the diagnosis to the patient and give appropriate management. But in communication skills, you don't need to diagnose anything. The diagnosis is usually given already to you, but you need to, there is some other concern or some other thing that you need to communicate to the patient. So for example, it can be breaking bad news station where you are already told that this patient has been diagnosed with, for example, colon cancer, and now you need to discuss the results with the patient, or the patient has been diagnosed with another serious illness, like for example, HIV. Okay, or you are talking to the patient relative. For example, you are talking to the patient's, the patient's daughter or patient's son, and you are going to tell them that their mother or their father, they have had a stroke, massive stroke, or any serious illness that has been diagnosed, and you are either breaking the news to the patient themselves or their relative, then this is going to be breaking bad news. Okay, so this is really going to test your communication skills on how are you going to, manage the situation tactfully and break the bad news in a manner that would, buffer the impact and uh, not have much devastating effect on the patient or the relative. And communication skills can be like dealing with an angry patient. Okay, so the patient is angry about something and you have to deal with him. Or it can be like a medical error, your team or you or your team has performed certain procedure or given certain management in which there was certain error, and now you have to communicate it to the patient. So these are basically your communication skills station. Then you have ethical dilemma station. So you are dealing with certain ethical dilemma here. There is no need to diagnose anything in this station. Our diagnosis is already given again, but they need to check your knowledge of how to deal with certain situations, whether you have knowledge of good medical practice or not, whether you can act ethically in certain situations. Okay, so these are ethical dilemma stations. Again, here your knowledge of good medical practice and your communication skills are tested. So for example, it can be a colleague is doing something which is not a good medical practice. They're either making their practice is either making the patients unsafe, or it's not in line with the GMC guidelines. So how you are going to handle this situation? So these are ethical dilemma stations. Then you have teaching stations. So in teaching stations, you are going to teach a certain topic to a nursing student or a medical student. Here they are testing your teaching skills, okay, teaching skills and communication skills. And then we have Simon-based stations. So Simon-based stations are basically acute emergencies. Okay. So in these stations, you have sort of a robot or an android human. It's a mannequin that actually talks. Okay. You can find the videos on YouTube of talking mannequins, and you can see how it appears. But these are the mannequins that can talk. How they talk, they are basically connected to a computer and they are fed data, and then they talk to you in sort of artificial intelligence voice. It's kind of a robotic voice, but they're able to talk. And when you ask them questions, they are, they can answer your questions. You can take proper history from them. They can perform certain other functions as well, like opening and closing their eyes, etc. So Simon-based stations are basically acute emergencies, and these mannequins, they are connected to a monitor, and the monitor shows vital signs like heart rate, blood pressure, and respiratory rate, temperature, oxygen saturation, and it also shows the ECG of the Simon. So you need to treat the Simon and then look at the monitor and then treat the Simon and look at the vital signs. And for example, it can be a serious situation like acute severe asthma, where you perform your management and then check oxygen saturation and then perform your management. So your task here is basically dealing with acute emergencies. Okay. Then telephonic consultation are, they are history-based stations usually, or they are communication skills stations. But a little bit difference here is you are talking to the patient on a telephone. So the patient is not sitting in front of you. So you have to carry out certain modification in your usual history when you are talking to the patient on telephone. So there is a telephonic station approach that I will discuss in a separate video as well. But here, um, I'll tell you briefly that you cannot carry out your examination on the telephonic station. So on the telephonic station, there is either three things that you can do when you take the history. These are basically triage stations. So you are trying to work out whether this patient has minimal symptoms, or this patient has a condition that is self-limiting, so they don't need to come to the hospital. You just need to give them general advice, or you need to tell them just take paracetamol, um, and the condition is self-limiting. So you just tell them over the telephone and ask them, to take rest and stuff. But some patient, you would ask them to come to the GP clinic because you need to examine them, or you need to do certain, tests for them. And some patients, their condition will be serious, and you will be asking them to go to the hospital, immediately to the emergency department. So these stations are basically there to judge your ability of triaging a patient, whether you are able to tell which patient needs to go to the ER immediately, which patient needs to come to the GP clinic, and which patient needs to stay at home. Okay. And then we have some counseling stations. So counseling stations, again, you don't need to diagnose here. The patient is already diagnosed, but you need to counsel him about some of his habits. Like, for example, if there is a diabetic patient and need counseling on diet, or need counseling on exercise. Or it can be a patient who is smoking a lot and need counseling on smoking cessation. Okay. So counseling station, again, you need a really good communication skills here. Okay, another station that I forgot to mention here is the 10th type of station is prescription station, where you are required to fill a prescription, a prescription for a patient. Okay. And then let's discuss the marking scheme now. So basically in PLAB 2 exam, you are judged in these three domains: data gathering, okay, management, and interpersonal skills. So data gathering basically means taking history, okay, and examination. So you are gathering data when you are asking questions in the history, and you are also gathering data when you are doing examination. So data gathering include history, examination, and also asking about the patient's ideas, concerns, and expectations. Okay, so it includes three things: history taking, examination, and ideas, concerns, and expectations. Then management means management basically starts with explaining your diagnosis to the patient. Okay, you come up with a diagnosis. Now, management will start with explaining your diagnosis to the patient in simple words, addressing any concerns that the patient is having, and then giving appropriate treatment for the diagnosis. Okay, so basically, management also include three things: explaining the diagnosis to the patient, addressing their concerns, and giving appropriate treatment for the diagnosis. Okay. Then interpersonal skills are basically your communication skills with the patient, how you are able to build a rapport, how you introduce yourself, how are you, are you actually listening to the patient? Are you expressing appropriate sympathy and empathy? I have done detailed video on what IPS actually is and how is it marked. You can watch that on my YouTube channel as well. Um, but basically, this is your communication skills, and it runs throughout your station. So it starts the moment you enter the cubicle, and it ends the moment you are leaving your cubicle. It's throughout your data gathering, your management, and even in your general body language. So you need to be mindful of that. Okay. Then I have this picture. Its quality is really bad. I'm sorry about that. But basically, what this shows is three domains in which you are marked. So this is basically station 1, station 2, station 3, station 4, etc. And these are your scores. This is data gathering. This is management, and this is interpersonal skills. And out of 4, you are marked here. So for example, you get 2 out of 4 in the data gathering, 2 out of 4 in the management, and 2 out of 4 in IPS. Then your total score is going to be 6. Okay. Then for each station, there is a certain passing criteria. So for example, for this station, the criteria is 5.9 two. So you have six, you scored six, so you have passed the station. Okay. Passing criteria is different for different stations. It basically depends upon how the candidates perform on that day. Okay. So for example, you have 20 candidates with you on the day of the exam, and all 20 candidates perform station one really well. So the passing marks for station one will be high. Okay. And then most of the candidates perform poorly in station two. So the passing marks for station two will be low. For example, the passing marks for station one can be 9, and the passing marks for station two can be 4. Okay. And then the total number, you need to pass a certain number of station and gain certain score in order to pass the exam. So mostly the passing number of station required to pass are 10, and the number of and the total score required to pass is about somewhere between 95 to 105. Okay, but it fluctuates. Okay. So these are basically your main three domains in which you are scored and you are judged, but they are further subdivided into these skill areas, and I will explain these skill areas as well. So these are about, I think, 10 skill areas in which you are marked. So one is consultation. Consultation basically means that the flow of your consultation or the structure of your consultation, whether you are organized or not. Okay. So this part here, uh, you are marked here if you are not organized. Okay. So then they will mark you down in consultation that your consultation is bad. Okay. So this basically means your organization skill. So if you are asking your history in really, in a really smooth way, you are exploring the presenting complaint, then taking history of presenting illness, then asking questions to rule out differential diagnosis and red flags. Then you are asking about the past medical history. Then you are asking about maftosa, which is basically any medication, allergies, family history, psychosocial, then lifestyle questions. Do you smoke? Do you drink alcohol? How about exercise? Tell me about your diet. So, and then you ask about ideas, concerns, and expectations. Then you go to the examination, and then you provide management. So this is basically a smooth flow of your consultation. Okay, this is good. But sometimes some candidates would they do is because of nervousness or anxiety or because they don't really know the station. They start, they just become haphazard. They're all over the place. They are asking some questions in the history of presenting illness, then they are asking about past history, then one question from um, lifestyle question, then they go towards differential diagnosis, and similarly in the management, they are not, following a proper order. So then they are marked here in the consultation. Okay. Diagnosis is basically diagnosis. So if you come up with right diagnosis, and that is good. But if you come up with wrong diagnosis, then you are marked here. Okay. Examination. So if in certain station you are required to do an examination, and or you are required to verbalize an examination, but you forget to do it, then you will be marked here. Okay. So findings is basically your examination findings. So if you fail to pick up your findings on examination, then you will be marked here. Issues are basically the verbal and the non-verbal cues that the patient gives you during the history taking. Okay. And so you are required to pick up on those clues. So for example, if the patient is restless and he's agitated, then you need to comment on that. If you fail to comment on that, then you are marked here. And similarly, the patient tells you about some concern, and the patient tells you about some problem, and you fail to acknowledge that, then you are going to be marked here. Language, as you all know, you have been already tested, and you are already been marked on the English language exam, either OET or IELTS, but still a little bit of fluency in the language is required. But more importantly, language in PLAB 2 exam means using simple language. Okay, so you should not use any fancy words that you know that you are using in your IELTS, because then you are going to be marked here, because you are talking with a simple layman. So you should use simple language. You should avoid medical jargons. And for example, if instead of elevated, you need to say increased, or your BP is raised. So simple language in the sense of English as well, and avoiding medical jargons and scientific language. Okay. Listening is basically active listening. So you should appear as if you are, listening to the patient quite attentively. You should, give eye contact. You should be nodding. And more importantly, you should not repeatedly ask what the patient has already told you. So the patient has already told you, doctor, I've been having this symptom for the past 2 months. Then if you ask him again that during the history taking, you ask him again, since when have you been having this symptom, then it will appear that you are not really listening to this patient. So then you are going to be marked here. And management, so if you uh, give appropriate management to the patient, that is good. But if you give medical management and you forget to manage the concerns of the patient, then you are going to be marked here. And similarly, if you don't give proper medical treatment, then again you are going to be marked here. Okay, rapport is basically your communication skills. If you know how you have introduced yourself to the patient, are you talking confidently to the patient, and how is your general attitude with the patient? That is basically rapport. And then time management is basically if you are able to finish your task in time, and that is good. But if you are not able to tell the entire management, you are not able to do everything in time, then you are going to be marked here. So that was basically all about PLAB 2. That was a general overview of PLAB 2, and so I hope it was helpful. And if you need to see further details on the medicine and peds and each section in detail, then you can find a separate playlist for each of the domains on my YouTube channel.